The landscape of community health is on the brink of significant changes, especially with the looming alterations to Medicaid regulations. In Ohio alone, approximately 60 community health centers operate, offering essential services to a diverse patient base, irrespective of their insurance status. Health centers that have federal qualifications, such as Five Rivers Medical Center, assert that the profound effects of the modifications to Medicaid won't be felt until the year 2027. However, a sense of trepidation permeates the community, stemming from concerns that patients might miss out on crucial health care due to misunderstandings regarding their Medicaid benefits. Gina McFarlane, the founder and CEO of Five Rivers Medical Centers, voiced her worries. What truly frightens us is the realization that if we can catch health issues early, we can effectively address our patients' primary care requirements. When fear sets in, many choose to withdraw instead of taking the initiative to seek help. In July, significant shifts were set into motion when President Donald Trump enacted the One Big Beautiful Bill Act, which encompasses revisions to work requirements at a frequency increase for Medicaid eligibility reviews. Advocates for these changes argue that tightening the rules can curtail fraudulent claims and streamline the system. A notable 59% of patients at Five Rivers rely on Medicaid for their healthcare needs. The demographic of Medicaid beneficiaries, as highlighted by the National Association of Community Health Centers, is diverse, encompassing children. Serving as a cornerstone of healthcare in Montgomery County, Five Rivers Medical Center stands out as the largest community health center in the area and the sole facility of its kind in Greene County. According to McFarlane L., Five Rivers is proactive in assessing patient needs during their visits to their Dayton location. Between 2018 and now, the primary barriers identified by Five Rivers patients have included challenges such as transportation, stress, housing insecurity, and social isolation, which underscore the complexities these individuals face in accessing healthcare. As per the Ohio Department of Medicaid, as of June, Montgomery County reported 165,802 Medicaid enrollments, representing 31% of the county's total population. Alarmingly, 13% of Five Rivers patients are currently uninsured, a number that continues to rise. For those without insurance, a sliding fee scale is available to help manage healthcare costs. Our mission is to ensure that we can see all individuals, irrespective of their financial situation, expressed McFarlane L. The Center for Community Solutions, a Cleveland-based think tank, warns that starting in 2026, states will undergo changes in how they can finance Medicaid, particularly by restricting taxation on certain provider types. The full brunt of new work requirements and revised eligibility checking frequency is set to take effect in 2027. In light of these impending changes, McFarlane L. actively encourages patients at Five Rivers to be proactive by carefully examining any correspondence they receive regarding their health insurance. Outreach enrollment counselors are available to guide them through any inquiries they might have about their Medicaid benefits. Our aspiration is to alleviate that fear, McFarlane L. concluded. Education about available resources is critical. Navigating these changes together is essential for our community. But here's where it gets controversial. The impending Medicaid modifications have sparked discussions about the potential fallout and how it might disproportionately affect the most vulnerable populations. As we dive deeper into the nuances of this issue, one can't help but wonder, will these legislative changes truly reduce fraud, or do they pose an additional barrier for those in need? What are your thoughts on this? Do you believe tighter regulations will genuinely streamline services, or will they exacerbate the already existing challenges faced by healthcare providers and patients alike?